Today we learn something about headache. Channel's name is Heartbeat. My name is Dr. Amrit Kejriwal. Definition: pain is in any part of the head is called headache. So it can be localized to a part of the brain, head. It can be unilateral, that is one side, or it can be both the sides. It can have an onset of gradual or sudden, may last for a few hours or days. It may be mild or severe, and it may have various types of characters such as sharp, dull, or throbbing. So depending upon these, you have to describe your headache whenever you go to a doctor. And doctors are usually asked these kind of questions. There are various types of headaches. So primary is when there's overactivity or issues of pain sensitive structures in the head or in the brain. Second is any disease that stimulates the pain sensitive structures of the brain. So even if you get fever, that can cause the stimulation of the pain sensitive structures of the head. Primary headache has got various causes such as migraine, cluster headache, trigeminal neuralgia, tension headache, cough headache, exercise headache. So these are the various types of primary headache. There may be some more. Primary headache can also be caused by lifestyle, irregular sleeps, irregular food. It can also be caused by alcohol, particularly red wine. Certain foods such as processed meats that contain nitrates. Change in sleep or lack of sleep can cause headache. Poor posture, skipped meals, and stress. So these are different causes of primary headache, which increases the pain in the sensitive structures of the brain. Secondary headache, there are again multiple causes. You have the brain disorders, you have the eye disorders, you have the ear disorders, chemicals and drugs. Blood pressure itself can cause secondary headache. And apart from this, there are many others. I'm not going to list down everything. Now, when do you visit to the doctor? The visits can be said as an emergency or routine. So let us see when you have a headache and which of the following cases it is supposed to be an emergency. When the person has a confusion or troubles understanding speech, then it's an emergency. If there's an episode of fainting or patient has high grade fever then more than 102 or 104 degrees Fahrenheit, 39 to 40 degrees centigrade, then it's a visit to the doctor's emergency whenever you have a headache. Numbness, weakness or paralysis of any limb or face. You have a stiff neck, trouble seeing, walking or speaking, and nausea or vomiting unless cause is obvious. So all patients who are having nausea or vomiting don't need to go to the headache if they have a headache. So selected patients of nausea or vomiting who have a headache should go to the doctor. If the cause is obvious, you don't need to go to the doctor. Routine visits to the doctor. Those were the emergency causes, reasons, and not going for the routine. So if there's an increase in frequency and severity of the headache, you have to visit the doctor. No improvement with appropriate medicines or need to take medicine every day, again you have to visit the doctor. If the headache disturbs in working, sleeping and day-to-day activities, then you have to visit to the doctor. Also, if the headache is uncontrolled on medications and you would like to change the treatment. So you just suppose you're on medications and you're still getting a headache, then you may need a change in the treatment, then you have to visit to the doctor. It's triggered by exertion, cough, bending or strenuous activity and more than 3 episodes of headaches per week. Now doctor, before you go to the doctor, you keep a notebook. Note down what precipitates the headache, the triggers, date and time pain started, what you have eaten in the previous day. Sometimes headaches are caused by some food, sleep and sleep disturbances, activity prior to onset of headache, and what was the duration, intensity, and what stopped it. So many of the doctors will ask you these questions. It's better you keep a notebook, and especially if you're having headache more than 5 to 7 days or 10 days, and you wrote keep this for 4 or 5 episodes of headache, then it's better. So you can also pinpoint yourself that what is causing you a headache. Saves your trouble and trouble to the doctor. More details, any sensitive light, odor or sound. Have you used any medications? And any stress or emotional conditions. Any influence from weather or daily activity. And any known health conditions at that time. Just suppose you're having blood pressure and blood pressure is not under control, then that can cause headache. Diagnosis. So you have to give a description of the headache, details, duration, frequency and severity, aggravating or associated symptoms, fits and weakness of any part of the body, and obviously a detailed examination will be required. So based on this, what is the exact cause of your headache, somebody may be able to find out. So it's better if you have a notebook before you go to the doctor and you write down everything by itself. There are various tests for investigations. Some of the patients require CT scan, MRI, MRI plus, that is MRI with contrast or angiography or venography, lumbar puncture, and EEG, electroencephalography. So these are different things. Not all the patients require this. You can try some home remedies before you visit the doctor for headache. Apply heat or cold packs to your head. Do stretching exercises. Massage your head, neck or back. Resting in a dark, quiet room. Take a walk and use any relaxation techniques that you have learned. So these all can help you reduce your headache. You can try these home remedies, except for the emergency conditions. You can try these for a day or two. If you don't improve, you can go to the doctor. Treatment. So you can have some medications as acetaminophen and painkillers. Some electronic medical devices are available. Many times the headaches are resolved by counseling, especially if you have stress management, and biofeedback methods. I'm not going to the details of all these. Monitoring treatment. Now the doctor has given you certain treatment, then you have to monitor whether you're improving or not. So you have to keep track of how well it's working. So you keep a notebook. Note down the frequency, severity, and duration of the headache from day to day and go back to the doctor with it. Prevention of headaches. Use a heat or ice pack. Avoid extreme temperatures. Never apply ice directly to the skin. Avoid stressors wherever possible. So just suppose you know that going down to the meet your friend may cause a stress. Because you're likely to meet someone else on the way. Then avoid those stressors. Eat meals regularly, taking care to maintain stable blood sugar. So remaining hungry can also cause you headache. Get enough and regular sleep. Irregular sleep will cause you headache. So get enough and regular sleep. Exercise regularly boosts overall health and lower stress. Limit alcohol intake and drink plenty of water. Take breaks when working to and stretch and prevent eye strain. This I've also mentioned in my videos on posture, especially on the mobile or computer or TV. So whenever you're working on TV for prolonged times or computer, watching TV, mobiles, that causes eye strain and that itself can cause headache. Thank you for watching the video. Please do not forget to like the video. Feel free to give comments. Please subscribe to the channel and share link with your friends. Thank you once again.